People don't realize how important emotions are on the metabolism. 75% of all conditions begin at the digestive level. For the last 100 years, there's a refusal to address the mind.
Can you give me an example of somebody that's angry? How does that affect the body?
Aneurysm, TBI, stroke. Average hormonal stuff is 6 to 10 seconds. Count to 10, it works. The body and the mind are intrinsically connected. You're reprogramming the nervous system. It feels as if you were having your teeth pulled out, all of your teeth, 24/7. Imagine this poor lady 1 week of that pain. She comes to me, I did acupuncture in her ear, and in 5 minutes, it's gone, the pain is gone, she starts crying. Although it's damaging you, you no longer feel it because now it's part of your genome and you pass it to your children.
When you know a client walks in and they've had a loss of a loved one that they've cared for the last so many years, what do you know you have to focus on?
Well, the first thing is you have to listen to them. When I was a kid in Europe, the first thing the doctor asked was,
Welcome back to Reboot U's podcast. I'm here with Dr. Miguel. He's an expert in Oriental medicine. And today I'm excited about our topic because we're going to talk about the emotional side of the body and the effect on it, trauma. And so what do you think with this conversation people are going to get from it? And why is it important for them to even listen to it?
well, thank you for having me, Fabian. It's always great to work with you. People don't realize how important emotions are on the metabolism. In natural medicine and Eastern medicine, 75% of all conditions begin at the digestive level. 15% of conditions are emotions. Emotional reactions. However, nowadays we know that because of the brain-gut or the gut-brain, where we have 3 times more neurons in the digestive system that we have in our brain, everything we eat is connected to our emotions. So you could say that almost 85% of everything is emotions. Every time you have a thought, every time you have an emotion, you're just driving, you see a flower, you get cut off in traffic. That's an emotion, that's a mood change, that's a metabolic change.
It's usually a bad emotion.
Yes, sadly so.
So why do you think this isn't something that we hear more about, like in medicine in general? Why aren't we taught this?
Because in Western medicine, for the last 100 years, there's a refusal by too many experts, too many physicians and academicians to address the mind. Whereas in Western medicine up until 100 years ago, and in Eastern medicine and Western natural medicine still today, the mind, the spirits, the emotions are the lump sum of the treatment. In modern biochemical medicine, they don't want to talk about it. They don't want to talk about the mind. That they call it the biological substrate, or the everything in the body is an epiphenomenon of biochemical transactions. The mind doesn't exist.
Can you give me an example of somebody that's angry? How does that affect the body? What does it affect and how?
Immediately, anger is connected to frustration and to resentment.
Okay.
So there are several enzymes that get triggered in the liver. The liver organ does 500 biochemical transactions per second.
Wow.
So immediately you're going to have specific toxic crystals in your blood. So you're generating your endogenous toxins.
Yeah.
That is going to go into your heart. Why? Because your heart pumps the blood.
Right.
So now you're going to be spreading like jello on a piece of bread, or jelly, I should say, on a piece of bread. You're spreading toxins in your own body through your heart. So those enzymes go into your heart, you immediately have a vasoconstriction.
Mm-hmm.
Why? Because those enzymes are provoking a heart reaction, a vessel reaction, vasoconstriction, headache, flushing in your migraine.
Yeah.
The expression, he got so angry he blew a gasket.
Yeah.
Right. Oh, okay, because the safeguard, which is the brain-blood barrier in your skull, the anger was so much, the safeguards failed, aneurysm, TBI, stroke.
Wow. And that's just all from being angry, but obviously for a certain amount of time, right? I mean, it's not...
Yeah, I mean, the average hormonal stuff is 6 to 10 seconds.
Okay.
So if that count to 10, it works.
So do you so essentially if somebody is angry, often for, what would you say, the period of weeks, months, years before it could turn into something that's
No,
you can notice?
chronic,
Mhm.
chronic anger is going to, within the Chinese dynamics, of course, is going to definitely develop. You're going to definitely develop digestive issues. You're going to have pains along the coastal region, constipation, depending on the individual's body mechanics.
So these are signs that you would notice?
Yeah.
Okay.
Yeah. If you pardon the reference, the common phrase, someone is retentive, right?
Okay.
Anal retentive.
Yeah.
Okay, that's related to chronic anger.
So even if they're a happy person, but they're super anal, is what we would say. Like that's
Yeah, because within the Chinese emotional dynamics, you also have frustration and resentment.
okay.
Frustration and resentment are lesser types of anger that are not let go.
Mhm.
And who lets go? The anal sphincter.
Right. Okay. In your experience, can somebody physically do everything they need to fix their body? And if they don't emotionally address it, they will go, what will happen if they don't emotionally address it?
The body and the mind are intrinsically connected.
Okay.
So if the person sincerely wants to address a problem, it doesn't matter if it's like when you have a bow. The bow has two tips. I mean, you can loosen the bow's rope. You can loosen it from this one or from this one.
Mm-hmm. Bow and arrow.
The bow and arrows, but you're going to loosen it anyway.
Right.
So you can start with the body, and therapy itself will take you to where you need to go. Or you can start with behavior, and the therapy will take you to where you need to go. And if you need to do physical, metabolic, biological, the therapy will take you there. If you need, it doesn't really matter when you start. Like I was mentioning before we started, I've had patients that have come to me for chronic low back pain, and after 1-3 sessions, they open up, and we realize that the chronic pain is coming from somewhere else. And we work with, we go from musculoskeletal to psychoemotional, and then they stay with me for forever, basically. Or not forever, because ultimately they get healed, but for the long run.
Wow. Give me an idea of if we focus on acupuncture.
Yeah.
What is it that really happens in the body when you put a needle in a meridian spot? Let's just say you choose a spot. What happens?
So, first of all, if I may, let's define acupuncture. Sure. Well, obviously, acupuncture comes from Latin to prick with a needle. We discovered during the late 20th century that when we talk about the Chinese meridians, we're just making reference to the nervous system. They're not hocus pocus, they're not hoodoo, they're not metaphysical, blah, blah, blah. No, they're the nervous system. Several levels. Some meridians are the actual nerves. Some meridians are part of the fascia network. Obviously, the fascia being the intermuscular filaments that we have. We have over 5,000 acupuncture points, and each of them is a microscopic bundle of nerves and vessels. And yes, we have to memorize most of them.
How long did it take you to learn all this?
Well, I have 2 medical degrees, one natural medicine, one Chinese medicine. Each took 4 years.
Okay.
Each acupuncture point has a special energetics, which means it does something.
Okay.
So where you place the needle, how you manipulate the needle,
Okay.
the direction in which you put the needle, what you do with the needle after you put it in, what you're doing is you're reprogramming the nervous system.
So I never heard about that. That's awesome, because putting the needle in and the direction and what you do with the needle in general, I didn't know there was more than one way to put it in. I just thought you pop it in.
Yeah, there's many schools within acupuncture itself. There are many schools of doing acupuncture, because like I've mentioned many times, acupuncture is one therapy within Chinese medicine. There's many therapies.
Okay.
So acupuncture, the acupuncture points are exactly like a keyboard in your computer. Each point is a key. Let's say the letter N. Okay, if I push the letter N, does nothing. But I have 26 more keys,
Okay.
and then the expression keys, and then I make a whole word. Now it's starting to make sense because I'm combining it with something else.
Yeah. Okay.
And then I hit the space, and then I could do another word, and then I get a paragraph, and then I can write an entire book. That's how acupuncture works. Depending how you combine it, you can elicit, when you write, you can elicit good and bad emotions, happiness, joy, frustration, anger, whatever. The same thing with acupuncture.
So when you put that needle in the right direction and everything's correct there, you said that you're creating is there a nervous system?
You're recoding the nervous system.
You're recoding it.
Because remember that the nervous system moves through electrochemical reactions. And the nervous impulse is the exchange of sodium and potassium in the nerve endings. It's the sodium-potassium pump in the neurons. The neurons don't touch each other. There's an electrical spark that passes from one dendrite and one neuron to the next one. Okay. Electricity is just frequencies. So each of the meridians has a different frequency. Think of a binary system. So what we call in the classical Western and Eastern systems, what we call the elements, or the different elements in their different parts of your body, we're talking about electrical frequencies.
Right.
So you're just recoding those electrical frequencies.
So I've seen some diagrams where you see the skeletal body, and then you see like the nervous system looks like a bunch of fluff going down through the whole body.
Yeah.
And so I thought that was a cool diagram because is that why you could say, I need help with my liver, and you hit the liver meridian and it's nowhere near my liver?
Correct.
Okay, correct. That's the part that always gets me in the beginning.
Yeah, I don't know why they called it. I'm not sure why they called it the liver meridian or the gallbladder meridian or the bladder meridian, because there's little reference or there's a little connection to the bladder, the physical bladder.
Yeah, right.
In fact, in Chinese medicine, which is Chinese medicine, is medicine. Okay, in the same way that the Mandarin or the Cantonese languages are languages, and you can say exactly the same thing that you're saying in English, or in German, or in Arabic. You just use different sounds, and those sounds we call a language.
Yeah, okay.
And each language has a different grammar and a different morphological structure to the sentence. Well, this is the same with Chinese medicine. So when we talk about the liver in Chinese medicine, unless I'm saying the liver organ, which in Chinese is gangfu, so I'm talking about the liver system.
Yeah, okay.
Those are different aspects of the enzymatic network, different aspect of the digestive system, different aspect of the cardiovascular system.
Oh, okay. When I started in this industry, you learn a lot. You hear about a lot of case studies, you go through it, but eventually when you start doing things and you see something actually work, it sells you on it in a sense.
Yep, absolutely.
Do you remember a couple times where you were just like, it was kind of miraculous to you what you were able to do?
Yes, that was actually when I was still a naturopath. A lady came to me with trigeminal neuralgia.
Yeah, it's a nasty one.
Okay, for those that don't know, trigeminal neuralgia is a horrible swelling of the trigeminal nerve.
Yep.
Which is one of the facial nerves. If you go to the dentist is going to, depending on if he's working on top or down, he's going to numb your trigeminal nerve, your facial nerve. Okay. So imagine the prick of the pain of the anesthetic injection in your jaw. Mm-hmm. Instead of being 2 seconds, it's 24/7.
I've had a client with that. I've seen. Yeah, just can't smile, not happy.
The trigeminal, it feels as if you were having your teeth pulled out cold.
Oof. Yeah.
All of your teeth, 24/7. Imagine this poor lady 1 week of that pain. 1 week, 24/7, no sleep, pain. Tooth pulling pain. She comes to me. She just spent 3 days in the hospital with Toradol, Neurontin, and morphine.
Wow.
Because that's what they do.
Yeah. What else?
But those are muscle relaxants.
Okay.
It's not going to do anything
To the nerve.
for the nerve.
Yeah. Okay.
It's like you go to the ER with a broken hand, you come up with a cast on your ankle. Yeah, but it's my hand that's broken. Yeah, but your health plan covers the ankle, not your hand. Yeah. So basically, I did acupuncture in her ear,
Okay.
which is auricular therapy. And I started just talking to her to calm down because she was obviously very distraught. And in 5 minutes, she realizes it's gone. The pain is gone. She starts crying. Eyeballs, 1 week, 5 minutes after auricular therapy, she starts crying. The pain is gone. Thank you so much. The pain is gone.
And that's it? How do you think that worked so well for her, that one point?
Well, it was at one point. It was a combination.
Oh, sorry, yeah, multiple points.
Yeah.
Okay.
Well, because the auricle in the ear is directly connected to the brain.
Right, okay.
So it's like immediate.
It just told the brain, hey, like, what, rewire yourself?
Absolutely, yeah. Like they said, it's a recoding. It's an electrochemical recoding. Because in the auricle, in terms of acupuncture, the first diagram system that came to the West was the ear.
Okay.
When the Spanish got to Asia, as opposed to, the Spanish Jesuits got to Asia, they sat down with the Chinese doctors. Nobody had done that before. Obviously, millennia of commercial, family, cultural exchange between Europe and Asia and Africa. But for some reason, up until the Spanish Jesuits, St. Francis Xavier, Father Rada from the Philippines and from Spain, nobody thought of sitting down with the Chinese doctors.
Right.
So they did. They translated the treatises back into Latin so everyone in Europe could understand. And the first one they translated was the ear system. Each part of the ear is a microsystem for the rest of your body and the metabolism.
Both ears?
Both ears.
Okay. So if you don't, I just got to go back real quick because that's miraculous with the trigeminal myalgia. So is there something that you knew from her that caused it for her to have that condition?
No, because as you know, trigeminal neuralgia is, like we say in medicine, unknown etiology.
Sure. Okay. And what made you treat that area specifically, the ear? Because there's a big connection there. Is that why? Or
Honestly, I didn't think that working any other point would work. In her case, I think it was just instinct that day.
yeah. Okay. So what was the next one? You're about to start with one. I can feel it.
We had one this week. In Reboot.
Which one was that again?
The girl with the chest pain.
Oh, yeah. Yeah, you did. It was immediate improvement that you noticed with her.
Yeah.
So, again, you kind of had an idea because they were at Reboot. You kind of had an idea of what was going on. So then you knew it could be X or Y. So let's put a needle in the specific spot.
Correct.
Okay.
Obviously, it's not just there's this thing called dry needling nowadays. You have people that take a seminar, maybe one weekend, maybe 1 week, maybe one fortnight.
Yeah.
I did 8 years. Right. So it's not only putting the needle, it's knowing why.
Yeah. Yep.
It's running in your head all of the scenarios. It's knowing the energetics of the body and which of the organs is failing, or where the blood impulse or the nervous impulse is jamming.
Right.
And just like in her case, and just move it. That's it.
That's awesome. We've been working well together now in Reboot, which is great because there's a synergy there. How do you feel like having or working with what you do in Reboot? Like, what do you see the benefit of having two together?
Like I mentioned, my other medical degree, natural medicine, I concentrated in 2 fields: Chinese medicine and non-invasive biological therapies, which is what you do.
Yeah, right. That's awesome.
Yeah, so it's right on my alley.
Okay.
Non-invasive biological therapies are wonderful because just like Chinese medicine, you don't need to poison your body with chemicals. You don't need to cut your body open like a cannoli. You don't need to burn it with radiation.
Great.
Okay, you just need to provide the body, which is a perfect functioning machine, the necessary tools for itself to regain health by regaining its own homeostasis.
Yes. Get the body to do its own job properly.
Exactly.
Yeah. No, that's awesome because what's been really cool is when we do our HRV scanning, which works all with meridians, meridian points, and sometimes I'll show you those diagrams, and then you do your own pulse analysis, which is essentially what the machine's doing.
Yeah.
And you can, in a way, confirm it that, yes, that makes sense. And those are the points that I want to hit. And so it's really cool to have that synergy where I can say, hey, here is an area that it looks like the client needs. You just confirm it and then you work on that.
That is absolutely true. And the confirmation element is the human element. Okay. AI, for example, or machines will bring you to a point, but the rest is the human intuition, human knowledge. And that's what
And what do you mean by that?
machines don't have feelings. And machines don't have meta communication. Computer programs cannot know if you're sad
Right.
as soon as they see your ass.
Right. That's okay. So that's where you knowing the person or seeing them and talking with them, yes, you're able to see. So let's say our A scan said the problem is with the heart. And then a client comes in and they had something that happened in the last a few months. You know their story. You know that they have loved ones that have issues.
Exactly. So that takes us back to trauma.
Right.
The heart's emotion is joy. The issue with the heart is that all emotions go back to the heart.
Okay.
So within the Chinese dynamics, the main emotions, sadness, worry, pensiveness, grief, pain, fear, fretting, fright, anger, resentment, frustration, all of them go back to the heart.
Okay.
And they can go back at the same time. And you have no idea when you meet people in the street. We have been trained to put on a mask. But once you lift that mask,
Yeah.
you see it.
So by a mask, you mean like a coping mechanism?
Coping mechanism.
Yeah. So that's kind of what started us on this whole, let's do a podcast about this, because I kind of learned this concept from another doc, which I thought was amazing. It made total sense to me that, the body works a certain way when you have a traumatic event, especially emotional, a loved one who dies, anything like that. It affects your body, of course, but then your body, like if it's something that's maybe you're caring for a loved one for 3-4 years straight, right? That's on their deathbed, and you're constantly having to deal with those emotions. It's something that builds up, but then your body adapts to, and it knows that it has to still survive. It has to work around it. So then, there's a point where that buildup, when you no longer have that tension, like my understanding is people get really ill or they get really sick at themselves.
And I will explain why.
Yeah.
So let's say I have a weird special sense of humor.
Yes, you do.
Yes. So I tell you a dad joke, and some of them you laugh, some of them you groan. But where's the punchline? It doesn't exist. It's all in your head. However, that thought, the image from the punchline, was still strong enough as to elicit a diaphragm contraction that we call laughter.
Okay.
Okay?
Yep.
So, and if it's a raunchy joke or if it's a dirty joke, which I wouldn't say because it's poor taste, you would maybe get blushed. So it's a strong enough thought as to provoke vasodilation. Okay? So imagine now, continuing the metaphor, that the same emotion due to the same experience endures for a while. So if the same electrical impulse endures for a while in your body, you go to green amino acids.
Okay.
If that endures for a certain time, I may be wrong depending on the medical system you're using, then you're making a gene.
How long was that roughly? I mean, is there a time?
Yeah, it's around 7 days.
Okay.
I studied was a long time ago. Yeah. So let's say 7 days, 21 days. So after a month, which is actually what most people realize when you move, when you change your car, when you move houses, I should say, when you move to a new city, when you move to a new job, when you change environments, that's the amount of time it takes you to become adapted to that the environment.
Yeah.
So the same thing happens in your body. If it's an afflictive process, although it's damaging you, you no longer feel it because now it's part of your genome and you pass it to your children.
So you've adapted to the pain, like if that's emotional pain.
You have internalized the pain and now it's become a chronic trigger.
Okay. So then where is that? What happens when finally that loved one unfortunately passes away and then now you get sick?
The same thing that happens when you stop eating.
Okay. Your body just starts depleting.
You start depleting. You starve yourself. So that, again, because emotions are at a different electrochemical level than the metabolism, you're going to get a different electrochemical reaction.
Okay.
And so you're not going to feel it immediately, but there is going to be rearrangement.
Yeah. Okay.
During 10 years ago, 15 years ago, the new Germanic medicine, as I was mentioning to you before we started, identified specific signs within the neurological system in the brain, ectodermis, mesodermis, and endodermis, the corpora cavernosa and the corpus callosum, which is basically the brain levels, the brain levels. Where you have those specific signs in an MRI or a CT scan, we have already identified which body part is going to receive the brunt. Once that emotional crisis subsides, you're going to have a physical crisis in that specific body part. For example,
When you're predicting it, they're predicting it?
yes.
Okay.
For example, why do many men get prostate cancer?
Okay.
Well, because in our modern society, men are expected to continue performing as providers, protectors, and sexually even beyond their menopause years, which is between 65 and 70.
Okay.
When we should already be retiring as men between 65 and 70, modern lifestyle has made it economically impossible. So many men have to continue. So the body is sending more energy to the prostate so that it continues being mad. But after a certain time, there's wear and tear and material fatigue, then wear and tear, and you develop cancer.
Yeah, that's amazing. So in your experience, when a client walks in and they've had a loss of a loved one that they've cared for the last so many years, what's your go-to? Like, what do you know you have to focus on?
Well, the first thing is you have to listen to them.
Right.
Because they're going to, even if they don't realize it, they're going to tell you. And the second thing is to empathize.
Okay.
Because love is love. I mean,
Right.
we all know what love is.
Right.
And so it's a fellow human being that comes with a broken heart. So that's the first thing, you empathize, and then you use the tongue, the pulse to see what their metabolism is doing. But from their speech, from their face, from their eyes, from everything they bring, you met the heart, basically. You never negate, you never repress the emotions.
Right. So like I know what we do at Reboot, for example, in that kind of a case, because I'm working off data. Right. So you're working off your own data screening.
Yeah.
So then so I know it depends on each person, but explain to me how you physically.
It's difficult because it's subclinical.
Okay.
So it's not something that the computer is going to tell you. Yes, if the computer can tell you because of the programs on the algorithm that if T3 has to be at so level and it's not, then we do this or that with this medicine to bring it down or to bring it up, depending what the case may be. Okay. But the computer is not going to tell you why.
Right, of course.
So the computer is not going to tell you that the person is burnt out.
So how do you treat somebody who's depressed with acupuncture or Chinese methods?
there's many causes for depression. Within Chinese dynamics, the depression can start in any of the five metabolic systems. And again, that comes from the symptoms, because depression has physical symptoms: sleep patterns, speech patterns, eye movements, the tongue, depending on which part of the tongue is showing which signs. There's 29 pulses in 12 positions. So you in addition to the interview and when you talk with the first thing you do is if there's any weaknesses, you tonify those weaknesses.
And you do that by what?
You can do that by with the acupuncture, but when there's depression, acupuncture is not enough. Depending on the type of depression, we have an assortment of Chinese herbal medical formulations that deal directly with, again, 9,000 years of clinical experience. These formulas go straight to the liver organ system, or the spleen organ system, or the kidney organ system, depending on where is that depression acted.
And you're finding these areas by the pulse analysis that you're doing?
Yes.
Plus, I'm sure there's other methods.
Yes.
So then tell me, because you mentioned the tongue a couple times now.
Yeah.
So what can we do at home when we look at our own tongue to see what's something that we can see and be like, oh, wow, something's wrong?
Well, the tongue coat.
The coating?
The tongue coat, yes.
So what would that be?
The tongue coat is basically what the stomach and gastrointestinal system are doing.
Okay. So what am I looking for?
Thickness.
Okay. Like a thick white coating? Or
Yeah, imagine a mayonnaise. I know it's gross. You have no idea how many tongues I see. So imagine mayonnaise, dry mayonnaise on top of your tongue.
Oh, yeah.
Okay? That's a full diagnosis there.
What is it?
Roughly. Roughly, that's cold dampness.
Cold damp.
So the Chinese system, cold dampness, means that your digestive system is not processing fluids and they're stagnating in your lymphatic system. So now you have a lymphatic congestion. So you have a hypofunctioning stomach, and even your glycemic indexes would be malfunctioned.
What would I potentially be feeling, or anybody at home feeling, if they had that thick white coating on the tongue and they can see it? Like, what could they be noticing?
Depends. Different people have different metabolisms, of course. So you bloating, you could be bloating, loose stools in the morning.
So like digestive issues.
Yeah, digestive issues.
Okay.
Lumbar pain that comes from nowhere.
So lower back pain.
Yeah, irregular soreness in your back. Knee weakness.
Knee weakness.
Knee weakness, yes.
Interesting. And so then, is there something simple somebody could do right away if they notice they have a white coating on the tongue? Like in your experience, just something, one or two things you could do at home? Or
Well, yeah. Immediately avoid greasy foods.
Okay.
Avoid sugary foods, white flours, sodas.
when you say sugary foods, like processed sugar or just high sugar?
Processed sugars, yeah.
Processed sugar.
Processed sugars.
Okay.
So basically, bakery, confections, soda pops, processed foods.
All the good stuff.
Yeah, well. So basically, cinnamon would help. Ginger would help.
Nice.
Every time you sit, first of all, sit down to eat. Don't eat on the run. Don't have cold drinks while you're eating.
Right.
If you want to drink something, drink after you ate, and try to have it be some warm tea like mint or ginger.
So why though? Why no cold liquids?
Because
And why
you need
something warm?
because the stomach needs warmth
Okay.
and
To digest.
to digest.
Okay.
Remember that the stomach lining is a collection of dozens of miles of capillary veins.
Right.
Okay, and they need warmth. If you have a cold drink, you're dousing the stomach fire. Imagine you want to brew some tea, and every time the kettle begins to boil, you throw a block of ice.
That's a good analogy. Yeah. Yeah. So that's a great analogy. So then, if we don't do anything to warm it up, does it just stay
If you don't do anything to warm it up, depending on the individual person's metabolism and stress levels, the response of the stomach nervous system of aligning is going to be hypo or hypo. That means that at the stomach level, the food is not going to be properly broken down into constituents. So when you get into the intestinal level, and when you mix the pancreatic enzymes, insulin, glucagon, glutathione, bile, you're not going to have a good digestion. You're not going to have a good metabolism of the food.
And then you'll notice like a gas and bloating.
And then you get a gut biome imbalance.
And then what happens if that continues on in your experience?
Well, there's 83 chronic pathologies related to gastrointestinal dysbiosis.
So is it safe to say that the majority of the people probably are having issues that are starting there?
Yes, it's safe to say that.
Okay. And I feel like I noticed that a lot.
Yeah.
I noticed that just when we're doing scans and we're seeing protein synthesis, or we're seeing the small intestines overactive, we're seeing the stomach's overactive, even down to being able to see that the mucosal lining of the stomach is showing inflammation.
Exactly.
And so that's the little capillaries you're talking about, right?
That's exactly right.
And so then ice water, it's served at every single restaurant, everywhere we go in the United States.
There you go.
Right?
Everywhere in the world.
Is it like purposely done?
No. Why no?
Why would we do that in the U.S.?
Politeness. Well, every time I go to a restaurant, if they, I don't drink alcohol, so if I just always say, "So, would you like to drink some water, no ice, with some lemon?"
No wonder you're so liar. No, but I noticed that when we went over to Europe, there's no ice water.
No.
Like, it doesn't exist.
No.
Granted, they do get bottled water, which tastes a lot better than if you don't have ice water in the, like, if you ask for no ice in your water in the US, there's a very good chance the water is going to taste shit.
Yeah. And it's still going to be
And that's probably why they mask it. You know me? And it's still cold. You're right. Yeah.
and it's still cold.
So I remember learning that a long time ago. Don't drink ice water while you're eating. So this is a great way to understand why.
Yeah.
Right? So that's a simple thing I think that we do all over the U.S. Is there anything else you can think of that we might be doing daily that's wrong that could be affecting digestion?
Every blood type has a different blood regimen.
Right.
So only O types should be having meat,
Okay.
red meat. It's not, having meat is not necessarily bad. But having a 32-ounce New York T-bone 3 times a week is not healthy.
If it's for a blood type A or B,
Whichever.
I mean any.
Whichever type. So overconsumption, binging, overeating, it's very unhealthy
Just overeating in general.
in general.
Yeah. Okay.
When you go to Europe, when you go to Asia, you go to restaurants, when you go to South America, you have the same quality of everything, but the rations are not such. So, I mean, it's like, I'm not an 8-foot giant, please. When I was living in New Mexico, I went to a very nice restaurant and I asked for a dish. I think it was a pasta, frutti di mare, which is basically pasta with seafood. And I thought, I got a serving fountain this big. Right. And I was like, but this is just for me. And they go, yeah, that's what you ordered. Yes, I know that's what I ordered, but this is for 2 or 3 people.
Right.
Seriously.
No, yeah, I've noticed that.
The stomach can take 14 cups of food, but who wants to? 1 ounce of meat takes 4 hours to be broken down in the stomach.
Okay.
2 ounces, 8 hours. 3 ounces, 16 hours. 4 ounces, 32 hours. So if you have a big chunk of meat, a 16-ounce steak, 3 times a day,
A week?
it takes over a week to digest that single steak. And how many meals have you had since?
Wow, okay.
And that's creating backup in your digestive system.
Right.
You and I have seen backup that goes into the small intestine.
How does somebody know if they have this backup? What would they notice?
Bloating.
Gas and bloating?
gas and bloating.
And then eventually IBS.
Not necessarily, but there would be a very bad halitosis. There would be stomach food retention, gas, bloating, severe pain,
Okay.
hemorrhoids.
Yeah. Okay.
Um, when John Wayne died 40, 50 years ago, he had 30 pounds of feces in his colon.
I remember this story. That's wild.
It's wild.
Yeah.
So let's say that, especially with this time of the year, people go on cruise ships. Okay? They binge 3 times a day for 10 to 15 days.
Yeah.
Okay, so your stomach still has 2/3 of the contents of your prior binging, and you're throwing more stuff in.
Yes.
There's no time to digest that. And you're doing what? Lounging at the deck. You're drinking alcohol, which is sugar and 9 kilocalories per ounce. So you're not digesting anything. You're fermenting everything. So you're not metabolizing any nutrients. You're just like gulp, 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 gulp. Okay? And then that means that your colon, which is only so long, cannot manage that. So you're going to have your 32 feet of small intestine full of feces.
And that's where colon hydrotherapy pull that stuff out.
Exactly.
And colon hydrotherapy is something that's been around so long, and I come by this all the time. People have never heard of it, never thought about that as a solution. People are looking it up more and more now, which is awesome. But again, in the US, it's just not a cultural thing.
No.
Right.
No, but as you well know, in classical medicine, before we had the machines for colonics, we still had enemas.
Yeah, right. Yes, enema's been around probably as long.
Millennia. In the ancient world, in Egypt, in ancient Greece, in Mesopotamia, we haven't discovered anything. If you study ancient medicine, and if you get rid of the chronocentric prejudices, the ancient world had electronics, microsurgery, neurological analysis, hospitals, sanatoriums, everything we have nowadays.
Right.
Okay, they would do stuff that we still cannot do 5,000 years ago. And they always started with diet and a clean cut.
Yeah. So that's a fundamental diet and a clean gut.
Yes, in the Ayurvedic system in India, which is where Chinese medicine comes from, everything is in the gut. Everything is a digestive fire. And when you go to an Ayurvedic doctor, the first thing that he goes is digestion. When I was a kid in Europe, doctors still did house calls. The first thing the doctor asked was, what did you eat? How are you sleeping? How are you feeling? And what did they do? They check your tongue, check your eyes or your iris. So that's the classical diagnosis.
Right.
And they knew if it was a psychosomatic issue, if he just needed to listen to you. Take 2 aspirins, go in the morning, which is basically you have nothing, just sleep it off, have a shot of beer, go to sleep.
Yeah. Let's throw a couple things back and forth here. I'll say one, then you say one. And we're going to base this on how to have the best digestion or support our digestion the most, like things we can do every day that are super easy to do so that everybody can kind of start working on it, right? So I'll start with when you eat a meal, sit down and at least for 15, 20 minutes after your meal, continue sit.
Absolutely, correct. Eat a meal, chew your meal,
Chew the food?
chew it.
Okay.
Yeah, many people don't chew enough. They may gulp it down. So it's not. The digestive system begins in chewing and the saliva.
Right. Yep.
Okay.
No one talks about that.
When he talks about that, so chew your meal.
Okay.
Take your time, enjoy it. Somebody worked really hard so that your meal was tasty. So you have to be thankful for that person and mentally thank that person that worked hard.
So you hit two things there. So chew it, but then also be present while you're eating.
Exactly.
Okay. Now why? Why do you have to be present while you're eating?
Because
I gotta watch
because
my
that food is going to
Mad Men show.
because that food is going to become your cells.
Right. Okay.
That food is you within the next 2-3 months.
So the environment you're in while you're eating, that's relevant as well.
Absolutely, absolutely. Uh, we all know about vibes. Right, saying so. If you go to a place and it has bad vibes, just don't eat there. Because that food is going to poison you.
Golden Corral. Bad vibes.
I have to say so. Yes. The last time I ate there, I got indigestion.
It's like walking into a Walmart, but you're actually walking and eating there.
Yeah.
Hey. All right. So then,
And then always have something warm after you eat.
there you go. Okay. So next one is something warm.
Yeah.
So like sipping on warm tea while you're eating, or not while you eat, after you eat.
So, in the old days, when we still were a civilized society, when you sat down, we went home to have lunch, or when we had dinner at home with the family, there was a 3-course meal, and maybe after dessert, you would sit down and have a warm tea, herbal tea if it was in the evening, or have a digestive Schnaps, eine Schnaps, ein Apfelstuhl bis ein bisschen Kaffee. Yeah, exactly. So that would settle down the stomach and propitiate digestion.
Give us one more little gem, Dr. Miguel, like something that people can take away that is useful for them that they can do at any time.
Well, there's plenty of things that are done.
Give me something, a little jewel. Come on, man. I know you got it.
Well, if on the emotional aspect or the digestive.
Oh, man, here we go. Sleep. How about something for sleep specifically?
Okay, so specifically also sleep hygiene. So one of the problems we've had in the last 5 years is 5G.
Okay.
5G is self-aware artificial intelligence. It was imposed during the pandemic, as many people know. I'm not saying anything that we don't know. But the problem is that our brain is also receiving 5G. So you have to disconnect from your phone and your computer and your TV at least 1 hour, 1 hour and a half before you go to sleep, so that you allow that 5G input coming in through your eyes and your brain to calm down. And so you allow your melatonin and your adrenal system to calm down your heart rate.
So that's one thing somebody can do that isn't sleeping well, you're saying.
Correct. Sleep hygiene. And then check your roof.
But how do you get away from the 5G?
Well,
I have to go off subject, but I agree with you, Dr. Miguel, but maybe there's something that's, I don't want to say more realistic, because that is realistic.
Yeah.
But if you have Wi-Fi in your house, you can't get away from it.
Correct. So just don't have electronics in your room.
In your room, like no TV, nothing?
Yeah. A classical Chinese feng shui, don't have mirrors in your bed, mirror in your bed. Don't have electronic.
Like mirrors above your bed?
No. Many people have a closet in the room, and the closet has a mirror. So the closet door has a mirror.
Got it.
Have some warm tea, relaxing.
Now we're talking.
Yeah, lavender, chamomile, passion flower.
Right before bed, or give it some time before bed?
45 minutes.
Before bed.
Yeah,
A good chamomile.
to wind it down. Have some nice books, and you can read some positive things that are not, constant crisis from television.
Yeah.
Dysfunctional families or dysfunctional TV programs.
Okay.
If you have to watch something watch something edifying.
Edifying?
Yeah, something that builds.
Elaborate on that.
Yeah, nature, for example, a documentary on something that interests you, whatever it may be.
Okay.
If like yourself, if you are into health, well, why don't you watch a documentary on the latest research?
Yeah, right.
If you like pottery, well, how about Japanese potters?
Okay, so we got an herbal tea.
Yeah.
And get your electronics as far as possible from you where your bed's at.
Yes.
And the other thing for sure is when you put your head on your pillow every night, just keep in mind that your brain and your body learns that, right? So if you put your head on your pillow and you're on your phone checking emails, your brain's not going to think that that's time to go to sleep,
That is correct.
right? It's going to assume this is still work time.
So that another trick. If you're married, never go to sleep angry.
Yeah, that's I intuitively live that, but I don't ever know why. I just make sure that happens for sure.
Well, because your wife in our case, or my wife in my case, obviously, whatever, whomever you're married to, is the most important person in your life at that time.
Right.
And you're sharing a lot more than a bed.
Right.
So those emotions, those go with you when you're sleeping.
Yeah. So I think we've got it nailed down. So we have an herbal tea. If don't have your TV on, if you have it on, at least have something that either is enjoyable or something enjoyable, positive, and then don't go to bed angry with your other half, whoever it is. Yes. And that gives us like 3 solid things that somebody who may not be doing can start doing. Right.
Prayer and gratitude, always good at the same time.
Okay. So before we head out, I just want to ask, what is something that's near and dear to you, something that a message you can give to everybody right now? If you had to just kind of narrow it down to one thing that's super important to you that you want to let everybody know.
Okay, so we're going into the Christmas season. The Christmas season has been celebrated for even before millennia. Even before Christ was born, Jesus was born, the Romans and the Greeks already had a Christmas season in December. So this is the season that we try to realize the divine in us. So I want to convey that like what God asked Cain. Where is your brother? After he had murdered Abel. And Cain said, am I my brother's keeper? Well, the right answer is yes, you are. Okay? I am my brother's keeper. And you are my keeper. We're in this together. So it's the bonds of friendship, it's the bonds of love, it's the bonds of sincere interest in the other, in our fellow human wellness that makes us do what we do in whatever field. Okay, if you're a waiter, if you're a cook, you're doing something for someone. Do it with love.
Okay.
And I do my medicine with love for my patients, because what am I doing it for? That's we are our brother's keeper. So just keep that in mind.
No, it's perfect. No, thank you. That's perfect. This was amazing. Every week I look forward to what we send back and forth, at our facility, but it's really cool to see that aspect from you. So I'm pretty sure we're going to do another one of these where we can dive into different subjects and how you can adjust it energetically to help the person, not just physically. But I appreciate you being on here because it's great information. I'm glad we could give some things people can do at home too.
My pleasure. That's what I'm here.
Thank you.